Hello everyone. So in this video we are just revise or just briefly showing a lower cranial nerves. So first we talk about trigeminal nerve. Okay. So it is a fifth cranial nerve. Generally it is a mixed type of nerve. It is a mixed type of nerve, that means the function motor as well as sensory also. It is longest and most complex nerve. It is the longest and most complex nerve. It has three divisions, that is ophthalmic branch, maxillary branch and the mandibular branch. Sensory function by sensory nucleus. So it has three sensory nucleus. First is mesencephalic, second is principal sensory and third is spinal nucleus. Now we first see about mesencephalic nucleus. So it arises from midbrain. So the function of mesencephalic nucleus is for proprioception. So it is a first mesencephalic nucleus. Second nucleus, that is principal sensory nucleus. It arises from bones and the function is pressure function. Third one is spinal nucleus, that arises from the medulla oblongata and the function of spinal nucleus is touch and pain function. See in the diagram, here the brainstem is shown. So it's a midbrain, bones and medulla here. Okay, so the first nucleus, that is mesencephalic nucleus, okay, it arises from midbrain. The principal sensory nucleus, it arises from the bones and the spinal nucleus arises from the medulla. So it's a three nucleus which are responsible for sensory function. The trigeminal nerve has less motor function. So which is the motor function we show? It supplies muscle of mastication and it supplies the muscles of swallowing. So which are the muscles of mastication and which muscles responsible for swallowing movement? So see, the first one is muscles of mastication. So total 4 muscle is there, total 4. Okay, so first is masseter, second is temporalis, third is lateral pterygoid and fourth one is medial pterygoid. So masseter muscle movement is elevation of mandible, temporalis elevation and retraction of mandible, lateral pterygoid, that means side to side action, the name suggests action, and medial pterygoid, that means it moves jaw forward and elevate the mandible. So the action of muscle of mastication. Next is muscles of swallowing. So that is first one is tensor tympani. It is also 4. Okay. Tensor tympani, digastric muscle, tensor palatini and mylohyoid. Tensor tympani muscle do a tensing into the tympanic membrane. Digastric muscle, it open up the jaw. Tensor palatini, tensing a soft palate, and mylohyoid do the elevation of hyoid bone and depression of the mandible. So these are the muscles of swallowing. Now clinical importance of trigeminal nerve. So if any damage to the trigeminal nerve or any injury, so that causes a trigeminal neuralgia. So what is a trigeminal neuralgia? Neuralgia, it is a suddenly, usually unilateral, severe, stabbing and lancinating type of pain at the mandibular and maxillary division of trigeminal nerve. So the pain is lancinating and stabbing type of pain which occurs suddenly, unilateral and severe type at the region of mandible and maxillary division. So that is known as trigeminal neuralgia. Etiology, idiopathic, because it is generally unknown cause. Some causes are like vascular comparison, CP, that is cerebellopontine angle tumor, the infections or the post-herpetic neuralgia. These are some causes which are generally responsible for the trigeminal neuralgia. The female is more affected than the male and right side of the face is more affected than the left side of face. It is epidemiology. The division wise આપણે જોઈએ કે કયા divisions માં વધારે થશે. So the mandibular is more affected than maxillary and the less affected branch is ophthalmic. So first is mandibular, second is maxillary and third is ophthalmic. Okay, so mandibular it is a third division, maxillary it is a second division, and ophthalmic is a first division. So most affected division is third division, which is mandibular division. Clinical features of trigeminal neuralgia, that is severe pain, that is type of lancinating and stabbing pain. Okay, severe type of pain is lancinating and stabbing. Cause continuous discomfort. Okay, due to pain it irritates a patient, itching thus a patient, and it produces a continuous discomfort and itching. No sensory or motor paralysis. Pain is generally increased during talking, swallowing, chewing, cold exposure, washing face, etc. PT management generally, for the pain relief we can give IFT in TANS modality, acupuncture, manual therapy, exercise to the temporomandibular joint, and facial massage we can give. Thank you.